The Executive Committee for Older Persons in Kampala, led by its chairperson Edward Lubowa, have demanded to be included on the list of those to receive aid from government in this lockdown. This was at a press conference in Kampala in reaction to their recent exclusion from the list of those expected to receive support.
It's important to know that these old age people are here. There is already a report from statisticians who say that the population of older persons is continuing to rise. Already they are speculating that by 2050, the population of older persons will be greater than the population of young people.
Lubowa says they are obliged to advocate for the welfare and rights of older persons and that efforts have been made to ensure that elder persons are represented, but all in vain. Lubowa says the population of older persons in Kampala is over 30,000, of whom 14,480 male and 17,070 females.
These ones need really to be assisted. Even if there are other people who need to get that assistance, but at least these ones are number one. 3,372 people in Kampala need to be assisted. And this money which is coming to help on this will be very useful for them.
He said the older persons in Uganda now have structures from village to parliament level. Thus, they need to be represented. The elderly are facing a number of challenges ranging from hypertension, diabetes, and blindness, among others, which lead to complications and reduction in capacity to generate incomes.
This country is now starting to get prepared for how to handle this population of older people. And we shall not wait. Let us start now to see that at least we plan and see how we can assist and give a good welfare to our people. These are people who should be respected, because whatever we are enjoying today was worked out by these people.
The Secretary, KCCA Older Persons Council, John Mary Byaruhanga, says majority of the elderly have no regular incomes and COVID-19 has complicated their lives.
We appeal to government to include the older persons. The older persons, they are most affected. They are affected in several ways, because these are people who are sick, who need medical attention. There are no medical arrangements whatsoever. Now, for example, for COVID-19 vaccination, there are people who could not make it to the vaccination point. So we tried to appeal to the Ministry of Health and KCCA. They seem to have no answer for that. So those people will be left out. And yet, they have sent back these children who have been in town. They are taking those COVID to them. So how is it going to be worked out?
The Secretary for Publicity, KCCA Older Persons, Henry Baguma, says the special grant for the elderly, SEG, is only accessible for persons over 80 years, and those below this are not some of the beneficiaries.
The money is a special fund and it's only for 60 years. And for us, we're advocating for people up to 60 years and above. 80 years have their money. But now we are saying those 80 years, we also need to anybody above 60. In fact, should even be 50 anyway. Why not? Even some people, 50 years, some of them look too old. They're unable to move because of vulnerability. So we are saying that government consider everybody at 60 years and above under old persons fund. And two, we are prepared to help government here and there to ensure this exercise succeeds.
The Council for Older Persons, Kampala Capital City Authority, is hopeful that there will be an intervention to have the elderly as part of the beneficiaries of the COVID-19 relief from government. Sudat Kaye, UBC.